Well, right now the doctors are in with a brand new front in the war on cancer, rallying the power of a patient's own immune system to fight the disease. Instead of the usual treatments you might be familiar with, like chemotherapy, for example, new drugs and practices transform the body's immune cells, leaving doctors with stories of nearly miraculous results in some of the most desperate cases. We'll get to that in a moment. What we're talking about is immunotherapy. Let's welcome three of the country's leading oncologists. Dr. Stan Gerson is the director of University Hospital Seidman Cancer Center. Dr. Padmani Sharma is a medical oncologist at the University of Texas MD Anderson Cancer Center, where she oversees immunotherapy trials. And Dr. Jed Wolchuk is the chief of melanoma and immunotherapeutic services at Memorial Sloan Kettering. You all get the awards for the most impressive resumes on our air for today, but it's great to talk to all of you as we take a look at what could be really a hopeful sign in this battle against cancer. Dr. Wolchuk, let's just start with you. Can you just tell us what exactly is immunotherapy?
So, first of all, thank you for having us. Immunotherapy is an effort to try to use the body's own immune cells and organs to fight cancer. We know the immune system is very good at eradicating or controlling infectious diseases like bacteria or viruses, which are dangerous threats to us. And we now know that the immune system can be directed to targets on cancer cells to eradicate them in some cases as well.
So, Dr. Sharma, how do you do it?
Well, basically at this time, the immune system had to go through a lot of different basic science research for us to understand what turns it on and what turns it off. And so now that we understand that they're on and off switches, we have learned that we can block the off switches. And by blocking the off switches, the soldiers of the immune system, the T cells, can then continue to attack cancer cells without being stopped by these off switches. And that's what leads to the tumor regression in these patients and the long-term survival of these patients, because the immune system is sort of a living being within you, and it continues to do its job for a long time, even after you stop giving the drug.
It's fascinating, Dr. Gerson. I wonder if you could give us an example where you've seen this actually work, where you've seen a tumor shrink or disappear.
Well, we have patients with non-Hodgkin's lymphoma, with melanoma. That's been the biggest example, certain colon cancers, and even some lung cancers, in which patients were desperate at the end of the road, if you will, from our conventional chemotherapy, who've had dramatic responses, new lives given to them for extended periods of time.
Dr. Wolchuk, have you seen the same thing in your practice?
Yes. I mean, we started off using these medicines in patients with melanoma who had very few good treatment options before 2011. And between 2011 and now, we now see the median life expectancy of someone with melanoma moving from 7 months to over 2 years. And as Dr. Sharma said, many of these responses are durable. What's been particularly rewarding is to see these same treatment approaches being applied across many different diseases.
And Dr. Sharma, you have some interesting examples as well of people even coming up to your husband at the airport. Because your husband is also a doctor, I should mention. You're both in this field together. He'll have to join us next time so we can make it a family affair. But you've also seen some incredible things.
Yeah. Absolutely. We've had patients come up to us, and even in my own clinic, where my patients are now returning over and over and over years later. You know, they come in the beginning and they say, you know, I just want to live a few more years to see my child graduate or something, and now they're here 10 years later and doing very well. So I think it's very promising therapy, and we're very excited.